Hey there, it's Andrea, Pharmacist. Okay, today I wanted to talk about the statin drugs. And I think the first statin drug came out in 1987. I graduated in 94 from Purdue. And so I did learn about statins, but from what I've been learning and researching, and I've watched hours of videos, I believe I was a little misled, like many pharmacists and doctors. I was always taught that very safe and effective. Sound familiar? And very, very few side effects. Very rare, very effective for lowering cholesterol. That was supposed to be so bad, like evil. I'm going to have to do this in more than one video because there's many steps. But today I'm going to explain. A lot of this started, and the reason I've been seeing all kinds of videos from doctors on YouTube is because of these new guidelines. They want to put, it's almost like they want everyone on a statin. And when I started working at the big corporate farm back in 2019, we used to have to make these ridiculous calls all day long. I would have like 30 calls I had to make. And after this, I've told you before, I started looking into everything that was pushed. And these calls would come up, and anyone who was on a blood pressure pill or anything for diabetes and you weren't on a statin, they wanted the pharmacist to call, and there was this big scary, they wanted me to scare you with this whole heart disease talk to scare people into, this is what I thought. I'm like, that is freaking scary. To convince you to allow me to call your doctor to see if you could be put on a statin as a preventative to heart disease. I knew instinctively it was weird. Why put somebody on more medications? It's just more to metabolize. I knew it could be hard on your liver. I knew some people had muscle issues, and I would warn people about that. But now you're wanting to put people on there that have no problems with cholesterol. So it's just in case, you know. Instinctively, I knew it was weird, so I never did it. I'd just call and say, how you doing? You want anything? So then after this, I'm like, why did they want everyone on statins? So I was talking to my sister, the nurse, and she said, oh, ask any nurse. That is the #1 drug none of us will go on. And I'm like, why? She says people are in the hospital all the time with rhabdo. Rhabdo is rhabdomyolysis. It is what I learned was extremely rare with statin use. And apparently she said they were in there a lot. It's life-threatening, and this is where the weak and sore muscles come in. Statins are breaking down your muscles. And if this goes on over time, your muscles, your kidneys can't get rid of this breakdown anymore, and it becomes toxic. Then you start going into kidney failure, damaged kidneys. And these were the people she saw in the hospital. So they were all like, we are never going on a statin. So I was like, this is when I started watching all the videos, like, okay, what's the deal? And with these new guidelines, there are many doctors on YouTube standing up and saying it's just these numbers they want, it's a blanket number, it's a ridiculous amount to maintain for proper health. And how are they coming up with here's what happens. A drug rep goes in to talk to a doctor, and they used to come to the pharmacy too, with their little pretty glossy literature, and they're saying things like, patients need to be on this to prevent them from having a heart issue by 54%. They're less likely to have an issue, or 36%. A 36% reduction in having a heart problem down the road. And so most doctors are like, wow, that's fantastic. But here's where the deception is. Because doctors started looking into this, like, where are they getting that? There's two numbers that there's like the relative risks and the absolute risks. The drug reps are telling the doctors the relative risks. When these doctors I listened to looked at the absolute risks, it's not 35, 54%. It's less than 1%. And I'm going to show you how I was watching this one, and they actually showed how they got that. And I hope you can kind of see it. Here's what actually happened. Okay, see, they're about the same, the risk. The red is the people that were on a statin, and the blue is the people that were not on a statin. And they look identical. So these researchers, these doctors were like, how did they get 35, 54%? This is for Crestor. The people that were on a statin had 0.35% incidence of heart attack, a heart incident. The blue, those are the people that were not on statins, and it's 0.76 of the people had some sort of heart incident, heart attack, stroke, something like that. So they're like, well, where do they get 54% from that? This is a relative number they're using. They're subtracting the two, and then they're saying that, here, let me give you an easy way to understand it. The group on a statin, let's say one person had a heart attack. These are out of 18,000 people. The people that were not on statins, 2 people had a heart attack. So they're saying you're 50% less likely to have a heart incident. That's how they're getting that number, based on 1 person and 2 people. And so then they're putting these people on statins. Now let me tell you the side effects of statins. This is where I failed people. I thought these side effects were very rare. These side effects are more prevalent than a 1% chance of having a heart attack over so many years. So if you're on a statin and you're experiencing any of these, you need to contact your doctor. It's the statin, and these are far more serious than this 1% minuscule chance you might have some heart attack in the future or heart issue. Dementia, very common. I saw many neurologists. You need cholesterol in your brain. It's like 23-25% of your brain. You need it for thinking, memory. Okay, so any dementia. It also, cholesterol lines all your nerves, all the pathway leading to your nerve endings. So if you're feeling any nerve pain, neuropathy, tingling or numbness in your extremities, that's from your statin, most likely. If your testosterone is in the tank, I heard one doctor say it reduces testosterone by 46%. Cholesterol is needed in the production of all your hormones. So all hormones, but mainly testosterone, because I've done a video about it. Everybody's in the tank. Diabetes. If you've been on a statin for a while and then all of a sudden you are type 2 diabetic, insulin, you can't, your blood sugars are too high, it's from the statin. You have, I believe, I heard once, it's like you hear different, but it's like 17% of the people, I believe. That's the one I heard. far more than this 1%. Keep that in mind for some heart issue. You cannot absorb vitamins that are fat soluble. That's your E. You can't convert and get vitamin D from the sunlight. Cholesterol is needed for that. So people are deficient in fat soluble vitamins and they don't have enough vitamin D. I've done a video about that too. Everybody's on the vitamin D supplements. All these problems will be solved if they quit overprescribing these statin drugs for people that they're really being misleading when they have lowered these numbers. And according to, you can go on YouTube, there's scads of them. There was a Dr. Berry, a Dr. Sinatra, a Dr. Diamond. They're all saying the same thing because they've broken down and looked through the literature to like, hey, wait a second, something's not right. They quoted studies where people that had a diagnosis of Alzheimer's, a group of elderly people, they were all on statins, took them off the statins, they no longer had Alzheimer's, or they were greatly improved. So my whole point is, if I was counseling in the pharmacy at this point, this is what I would be telling you. Not everybody's the same. Sure, in low doses, some people, if they've already had a heart attack, heart issues, maybe a small dose of statin, these side effects get worse with the higher strengths. And so it's dose related. But these people that really aren't having any issues, never had any heart problems, but they're putting you on it just in case, that's where I'm thinking that you need informed consent and to understand what the risks are, the side effects, before making that decision. You also can correct a lot of things with diet and exercise. And if it was me, my husband was on a statin. His testosterone was drastically decreasing. So I told him to stop taking the statin. His testosterone is pretty good now. So I'm just saying. It's a real issue. So I just wanted to give you the side effects of the statins. I was reading a lot of comments from people after these videos, and many people were like, they had no idea that their muscle pain and weakness was coming from the statin. They weren't putting it together. Because what's happening in healthcare is you're going in with a symptom like that, and you might be just prescribed something for pain or some sort of gabapentin, Lyrica for nerve pain, instead of finding the root, like this statin drug is causing that. And there's other options that your doctor should be flexible. And if you want to go to Dr. Ken Berry and get the actual studies and the breakdown, he does it all, you can print them out. And those things are, I really need the breakdown, because if I try to read through those, I'm not a researcher. These people are breaking it down for us. So, very helpful. Anyway, that's my spiel about the side effects of the statins, so that you can make an informed decision on whether it's for you. And I'm going to do another one on what the whole cholesterol. I've gathered so much information. I just don't want to throw it all at you at once, because it's going to be several different videos. But that's my spiel on the side effects. It's the same thing I would tell you if you came into the pharmacy and were asking me about it. I once had this woman was 80 years old. She came in and she was being prescribed a statin. Never had any problems. I think they were just putting her on it because she was old. I said, do you want to take it? And she said, no. I said, you don't have to take it. You don't have to. If you're not having any problems and you've lived to 80 something, you're doing something right. We're not in the same box, people. Everybody's different, and it's not just a black and white thing. So you can be part of these decisions because it's your body taking the pill. So anyway, that's my spiel.